HIV/AIDS is a chronic and potentially life-threatening condition caused by the human immunodeficiency virus, which damages the immune system and hinders the body's ability to fight infections and disease. The initial symptoms can be flu-like, including fever, sore throat, and fatigue, but as the illness progresses, it severely weakens the immune system, leading to more serious infections and diseases. Without treatment, infections called opportunistic infections can occur, as the weakened immune system loses the ability to defend against illnesses that would normally not cause harm. However, with modern antiretroviral therapy, people with HIV/AIDS can live long, healthy lives and significantly reduce the risk of transmitting the virus to others. Major risk factors for contracting HIV include unprotected sexual contact, sharing needles or syringes for drug use, and transmission from mother to child during childbirth or breastfeeding. Here's a detailed look at the various aspects of HIV/AIDS that impact lives around the world. Symptoms and progression of HIV/AIDS. HIV/AIDS is typically characterized by its gradual impairment of the immune system, which leads to increased susceptibility to opportunistic infections. In the initial stages, individuals may experience flu-like symptoms such as fever, sore throat, and fatigue, often not recognized as HIV due to their nonspecific nature. As the disease progresses, without treatment, the virus significantly depletes CD4 plus T cells, critical components of the immune system. This weakening leads to the emergence of AIDS, marked by severe illnesses such as tuberculosis, Kaposi's sarcoma, or neurocognitive disorders like HIV-associated dementia. Chronic HIV infection can also contribute to other long-term issues, including cardiovascular disease, kidney disease, and certain cancers. It is the progression and interaction of these conditions that often define the course of the disease, emphasizing the importance of early diagnosis and antiretroviral therapy to manage the infection and maintain immune function. Diagnosis of HIV/AIDS. The diagnosis of HIV/AIDS is a pivotal moment that significantly impacts a patient's life. It hinges on sophisticated testing methods like ELISA, Western blot, and PCR, which can detect the presence of antibodies, antigens, or the virus's genetic material. Acute diagnosis is life-saving, triggering entry into a treatment protocol with antiretroviral therapy, potentially transforming a once deadly disease into a manageable chronic condition. Early detection is crucial. It not only helps to prevent disease progression, but also curbs the transmission rate by facilitating timely interventions. Moreover, diagnostic methods are continuously evolving to yield faster and more accurate results, further empowering effective disease management and epidemiological control. Cause and risk factor of HIV/AIDS. HIV/AIDS is caused by the human immunodeficiency virus HIV, which targets the immune system, specifically CD4 T cells, weakening the body's defense against infections and diseases. Transmission primarily occurs through unprotected sexual contact, sharing needles among drug users, transfusions with infected blood, and from mother to child during childbirth or breastfeeding. Risk factors include having unprotected sex, multiple sexual partners, and STIs, which can create genital inflammation, increasing vulnerability to HIV. Intravenous drug users who share needles face high risks, alongside babies born to HIV-positive mothers. Certain demographic groups, such as men who have sex with men, are at a heightened risk due to prevalent high-risk behaviors within the group. Treatment and management of HIV/AIDS. Treatment and management of HIV/AIDS have revolutionized patient outcomes since the disease first emerged in the 1980s. Antiretroviral therapy, ART, has been the cornerstone of managing HIV, turning what was once a fatal diagnosis into a manageable chronic condition. ART works by suppressing the virus to undetectable levels, keeping the immune system intact, and reducing the risk of transmission. Beyond medication, management includes monitoring for and addressing opportunistic infections and comorbidities. Psychological support, lifestyle changes, and nutritional interventions are also key components. PrEP, pre-exposure prophylaxis, and PEP, post-exposure prophylaxis, are newer strategies in prevention. Stigma reduction and increased access to care remain critical in improving life expectancy and quality of life for those living with HIV/AIDS.